I had planned for a natural birth with no drugs and no interventions, and then the reality was that because of fetal distress, I ended up going for an emergency C-section. In terms of the second C-section, I definitely heard that, once you have a first one, you generally have a second one. Most of the people I know who've had one C-section scheduled the second one without thinking about other options.
The C-section rate in BC has been climbing for over the past decade. Right now it stands at about 37% of all births, and a large proportion of those C-sections are repeat, so people who have had one previous C-section. Compared to the rest of Canada, our C-section rate is higher, and there's a bunch of things that can contribute to that, and one of them is around decision-making for a birth after a previous C-section. The My Next Birth tool, we developed this over a number of years with care providers. It was led with Perinatal Services BC and the Ministry of Health and regional health authorities. And the aim was to create something that could help catalyze good conversations and have those conversations start much earlier in the pregnancy journey.
With Nathan, I used the tool for myself to kind of go through and clarify what was important to me in terms of my second birth.
People want personalized information, like what is my own chance of having a vaginal birth after cesarean if I plan one? And we know in BC that over 75% of people who've had a previous C-section are good candidates for a vaginal birth after cesarean.
I think that the tool really helps to clarify what is important to people in terms of their next birth after having a first cesarean, and it also really helps to empower them to talk with their care provider about those things and what they kind of envision for their next birth, whether or not that goes to plan.